Intellectual disability involves problems that affect cognitive or brain functioning, things like learning, problem solving, and judgment. It also includes what we call adaptive functioning, which is how a child handles daily life activities like communicating and taking care of themselves on their own. Intellectual disability can be predicted in early childhood, but usually is not given a diagnosis until after age 5 when a child doesn't meet the expected developmental milestones. If you think your child might have an intellectual disability, the first step is to talk with your child's healthcare provider about your concerns. What happens once my child is diagnosed? If your child is diagnosed with an intellectual disability, they'll be entitled to services provided by your local area. Until your child is 3 years old, when delays may be noticeable, even if they haven't yet been diagnosed, services are provided through early intervention. A services coordinator or case manager can work with you to develop an individualized family services plan. Services may include individual therapies, playgroups, parent training, and family counseling. When your child reaches age 3, your public school system begins to provide the needed school and therapy services. The Individuals with Disabilities Education Act entitles children with developmental delays and intellectual disabilities to a free and appropriate education based on their needs. Children with disabilities do not need to wait until kindergarten to start public school. Can intellectual disability be cured? Intellectual disability is a lifelong condition, but early and ongoing help may improve a person's day-to-day life and help them to thrive as they grow. After diagnosis, the focus usually shifts to looking at a child's specific strengths and needs, including what kind of support they need to function at home, in school, and in the community. Treatment is focused on giving each child what they need to meet their goals. What can I do to help my child with an intellectual disability? As a parent, there are many things you can do to support your child. It's useful to ask for help understanding your child's specific disability. Connecting with other parents of children with disabilities can offer a source of support for the whole family. It is also important to be patient. Learning may come slower for your child. Periods of gain may be followed by periods of slower progress, but we don't expect a child to lose skills. It's also important to encourage independence and responsibility, making sure your child is doing what they can for themselves. Laws have been written to help your child live their best life. It can help to learn about these laws to educate yourself on the educational services your child deserves. You can also look for opportunities in your community for social, recreational, and sports activities, things like Special Olympics or Best Buddies. Boston Children's Hospital is committed to keeping children and adolescents healthy. If you have any concerns about your child's development, don't wait. Speak with your primary care provider or visit bostonchildrens.org right away.